Now, from ABC4 News, coronavirus preparation versus panic.
Thank you so much for joining us tonight for this special presentation, Coronavirus Preparation versus Panic. I'm Glenn Mills. Right now, most of the country is under stay-at-home orders, schools are closed, and unemployment at record levels. In a Kaiser Family Foundation poll earlier this month, 45% of people said stress related to the coronavirus had a negative impact on their mental health. We could all use some tips on improving our mental health right now. For more on that, I am joined by Monette Cash, a licensed social worker from St. Mark's Hospital. She joins us from the backyard studio. Monette, great to have you with us. Thanks so much for being here. This is such an important conversation and something I've really been worried about because I don't think it's getting enough talk right now. So let's get right into it. What are some ways that can be helpful to really reduce stress during this very stressful time?
Well, you're absolutely right. A lot of people are really struggling right now, especially with anxiety and feeling overwhelmed with uncertainty in general. So one of the tips that the mental health professionals are giving right now are, to stay connected. There's, I think, a lot of my colleagues that were frustrated with the term social distancing. We wish it was physical distancing because a lot of people are really isolating themselves socially. And that, as you know, can lead to depression and actually make our anxiety worse. So staying connected socially is really important.
And let's get into ways to do that. How's the best way to stay connected socially? I mean, we have FaceTime and other opportunities as well.
Yeah, that's the good news is we actually have the internet now where, as other previous years in history, we didn't have that. So that is something we could use to our advantage. There's an example that I just saw in my neighborhood yesterday where they had divided the street and there was barriers and they were playing pickleball on either side of the street and they had their gloves and mask on. And I thought that was an awesome way to stay connected with their neighbors and in a safe way. Another example is, there's a lot of apps online. So there's one I think called Nextdoor that one of my clients used last week. She's a single mom and her daughter needed some art supplies and she didn't have any, and so she put that on that app, and within 15 minutes she saw on her front porch that she had art supplies delivered for her child. Yeah. So I thought that was a really cool story and just a really awesome way to stay connected.
I was at a Jordan Landing on Saturday out at a restaurant there, and I saw families in the parking lot. Kind of their vehicles were in different spaces in the parking lot. They were tailgating, and that was also what appeared to be a very safe way to stay connected as well.
I love that. Yeah, that's a great example as well.
Okay.
There's ways to do it.
Yeah. So what are some specific coping skills people can try when they're experiencing things like anxiety and depression?
So there's so many, right? But one of them important, probably one of the most effective that anybody can do is number one, control and let go of what you can't control. And probably the most important way you can do that is by staying focused in the present moment. We know that there's a lot of predictions about the future. We can say what if, we can think what if, we can do that in front of our kids and make them anxious as well, or we can really stay focused in the present moment. So I actually teach an exercise to my clients called grounding. In this ground exercise, I just have them tap into the 5 senses and really pay attention to where they're at and smells and sights. It was a warm day today. We can get outside and we can smell the fresh air and we can, look at some colors. There's a lot of flowers out, and just tapping into that present moment and staying mindful with whatever we're doing. That will really help reduce anxiety a lot.
Okay, so people experience the main not have before this pandemic, but others are dealing with pre-existing mental health conditions. What advice do you have for those who are probably feeling even more overwhelmed now that we're in the middle of this pandemic?
I'm so glad you asked that because, I cannot ignore the fact that actually we've seen a rise just in the last 4 or 5 weeks in domestic violence. We've seen a rise in child abuse. This is really taking a toll on relationships in general, right? People are either, most people are at their worst, but people can also be at their best. So people with pre-existing conditions like kids with ADHD or people with anxiety and depression, those are the ones that need to seek support a little more actively. And there's actually shelters that are open. There's numbers that you can call. There's ways that you can reduce that loneliness and get extra help. so that, and you have to work a little bit harder when you've got a pre-existing condition.
Yeah.
And so speaking up and asking for help and letting people help you is very key for people with mental illness to begin with.
Let's dig into that a little more, specifically people with children. Right now, children are home all day long. Parents aren't used to that. It can be taxing. What advice do you have for those who are now dealing with children more than they have in the past?
So one thing we need to remember about children is they're usually not very verbal. They're not always going to tell us how they feel, but they will act out, right? So you can pretty much expect tantrums. You can pretty much expect them, being loud and losing their cool. You pretty much just need to expect that. But one of the things that you can do is allow them to express it. So any kind of art projects, chalk the walk is kind of a popular activity right now. I know my grandkids were out there chalking the walk and, just doing anything tactile with their hands or any form of expression other than verbal expression can really help the parents and the kids as well keep their peace of mind.
Yeah, I've been seeing a lot of that myself, and it looks great, actually, out in the community as well. All right, let's talk about one last thing. Right now, a lot of people are feeling anxiety, depression, feeling down. At what point do you need to realize, look, I need to go even further with this and get some professional help, or I can manage this on my own? What advice do you have for us there?
Well, of course, as a mental health professional, I'm always going to encourage people to get help, right? The issue at hand right now that's interesting is the duration. So I think anybody can struggle with depression or anxiety for a few weeks, but I think we're going on, week 5 or 6 here? And so the duration and the length of time is really taking its toll. And so I encourage people to reach out now. There's a lot of online support groups. There's a lot of apps that can help reduce our anxiety. There's one called Calm, where they do a lot of breathing exercises that can help. I do telemedicine and teletherapy. So I know that there's many websites where you can actually seek counseling online, and there's a lot of therapists that are doing that right now. I'm very busy, and I know a lot of my colleagues are as well. So there is always help available. Yeah,
I would imagine you are. Thank you so much. Again, a very important conversation. How can people get in contact with you?
So the best way is just our website at stmarks.com, stmarkshospital.com would be probably the best place to go, and we'll post a lot of resources there for people as well.
Okay, fantastic. Monette Cash, thank you so much for your time tonight. We really appreciate it.
Thank you.
Coming up, the governor's plan to reopen Utah's economy has 3 phases. We break down what each phase means for Utah businesses that have remained empty for weeks.
You're watching Coronavirus Preparation versus Panic.
We're back now with one of the big questions on many minds. When will Utah reopen its economy? Governor Gary Herbert recently updated his plan for when that moment comes. He's calling it Utah Leads Together 2.0. This is the timeline of his 3-phase plan. Urgent is where we are now. Only essential services are open, and we're socially isolating across the state. After the urgent phase, stabilization is next. After that comes the recovery phase. Some business owners have expressed relief at the governor's new plan to reopen the state. For a closer look at what each stage entails and the potential timeline, we go now to ABC4's Sarah Martin.
This plan really feels like a light at the end of the tunnel because finally it's some real detail and a real timeline for when businesses could be back open.
We're down about 80% overall in sales.
John Allred owns the one-man band restaurant in Lehigh. He says he's refused to lay anyone off, but at this point he's completely running on his savings.
Really looking forward to May 2nd when we should be able to reopen the dining room, and hopefully that starts the road up.
Governor Herbert's new plan says beginning in May, Utah will step from the urgent phase of this pandemic into stabilization. That means slowly reopening businesses and services with extreme sanitation and social distancing guidelines. For example, reopening elective surgeries and eating inside restaurants with far fewer people at a time.
I'm expecting reduced capacity. Maybe we block off every other booth, change our method of service to kind of keep that social distance and keep people safe.
The stabilization process will last until about October. If all goes well, we'll begin the recovery phase.
I've kind of accepted that I'm not going to make any money this year, but I've got 20 years worth of history here that I need to preserve.
John says he doesn't have much faith in the payroll program, but if he can open his doors, the customers will come.
Thanks to all of our customers for continuing to support us, and we want to be here for you when we reopen.
This timeline is great to have, but it is not set in stone. Governor Herbert was emphatic that this timeline is created based on data, and it could change based on data as well, our number of cases and our access to testing. We'll keep you updated. Reporting from Lehigh, I'm Sarah Martin, ABC4 News.
Salt Lake County is easing up just a tiny bit on its stay-at-home restrictions. Mayor Jenny Wilson announcing that residents of Utah's most populous county can move around more freely, as long as they take the necessary precautions. ABC4's Rick Aaron explains.
I think it's time that we start looking at how we can get back as a community in the weeks to come.
While Salt Lake County leads the state with 1,456 cases and 12 of Utah's 23 deaths, the executive director of the county health department says new COVID-19 cases are decreasing.
Overall, the trend we are seeing is gradually downhill. And that's what we need to keep seeing. Stay smart and stay safe. And so this is a focus on continuing social distancing and employing the use of a face covering whenever we are out in public.
The county announced today that customers will be allowed to enter restaurants to order and pick up food instead of just getting curbside pickup.
And so what this now means for food service establishments, employees need to be wearing a face covering while working. The establishment needs to set aside clear distinctions of an ordering line and a pickup line, and making sure that there are markings so individuals can remain 6 feet apart.
Mayor Wilson says there will be more restrictions lifted if cases continue to go down.
We're easing, but it's not a big step today. What we're saying is we're easing a little today, and we're planning for the next few weeks. But we won't ease up in larger ways until we have even more data stability.
Coming up, if you've lost your income because of the pandemic, there's unemployment insurance and pandemic unemployment assistance. How to know which one you should apply for next.
You're watching Coronavirus Preparation versus Panic.
Welcome back. Utah unemployment claims continue to rise at historic levels, but more resources are becoming available for Utahns who are out of work. According to the Department of Workforce Services, 24,000 more people filed for unemployment benefits in the week ending with April 11th. For context, the average number of weekly claims in 2019 was just 1,100. In just 4 weeks, more than 106,000 people filed for unemployment here in our state. Many viewers who send us questions about the COVID-19 pandemic want to know what help is out there for them if they've lost their job or can't work anymore. Questions like this one. I'm employed and had to close up the salon I work at. Can I file for unemployment? Well, unemployment is available along with other resources for those who lost their jobs. One of those being pandemic unemployment assistance for those who are self-employed or lost their income. Both of those programs have to be applied for weekly. ABC4's Brittany Johnson has details on who is eligible for which program and how to apply.
There are two different unemployment insurance programs, traditional and pandemic, and it's important that you apply through the right program. Traditional unemployment is for those who have been laid off, furloughed, had hours reduced, and are able, available, and expected to return to work. Pandemic unemployment is for those that are self-employed, independent contractors, or gig workers. If you fall into that category and have lost your job due to the COVID-19 pandemic, you can now receive unemployment benefits for the first time.
They lack the sufficient wages to be able to qualify for the traditional unemployment benefit, or they have been diagnosed with COVID-19.
To receive assistance, go to jobs.utah.gov/COVID-19.
There is an Am I Eligible button. If you click on that, you will enter your social security number. If it comes back with a monetary decision as eligible, then you should apply for the traditional unemployment benefit. If it shows that you are ineligible or $0, then pandemic unemployment assistance is the correct application. Individuals that are determined eligible for pandemic unemployment assistance will also qualify for the additional $600 per week as part of the CARES Act. And those that have applied for unemployment or are receiving unemployment cannot apply for the pandemic unemployment assistance.
For other assistance programs available throughout the Department of Workforce Services, go to our website, abc4.com. Reporting in Salt Lake City, I'm Brittany Johnson, ABC4 News.
The state has announced a new grant program to help child care providers who are keeping their businesses open during the pandemic. According to the Utah Office of Child Care, 38% of Utah child care facilities have closed. And for the care centers that are still open, enrollment is way down. That's where the new Utah Child Care Operations Grant Program is supposed to come in.
The funds will help these programs pay rent, make payroll, purchase supplies, and meet the new health and safety requirements that programs remaining open must meet.
The grants are available only to licensed child care providers who remain open through the pandemic. To apply, owners must complete forms on the jobs.utah.gov website. If approved, they will receive monthly funding until the state determines they are able to return to normal operations. Small businesses all across the country are waiting for a deal on more funding designed to help them weather the coronavirus crisis. An initial $350 billion in funding for the Paycheck Protection Program was exhausted in less than 2 weeks. ABC4 News spoke to one of many Utah businesses awaiting a Paycheck Protection Program loan. Trish Benyon opened her first salon back in 2004. Her small business dreams are taking an unexpected hit now, as you might imagine. She's had to close up shop during the pandemic, leaving an uncertain future for her and her 52 employees.
I'm not a crier, but I curled up in bed and cried. I've been guaranteeing these 10 girls that I'll bring them on as soon as I get that PPP loan.
Utah banks and credit unions are also calling on Congress to expedite additional funding as some businesses are left pending and others with no way to apply for the Paycheck Protection Program. U.S. lawmakers have said a deal on more PPP funding is close. Another possible option for help for small businesses is the Economic Injury Disaster Loan to help meet working capital needs caused by a natural disaster. We'll be right back.
With the massive impact of COVID-19, we visited the Salt Lake County Health Department for the proper and effective way to wash your hands.
Okay, so I'm going to contaminate myself. So, start by wetting your hands, getting them soaked, and you want to lather first, palms together. Then you do the backs of your hands, and then interlace your fingers with palms together to get between your fingernails, or between your fingers. And then you clasp your hands like this and rub back and forth, and that kind of gets the backs of your fingers as well as your fingernails. And do the other side. And you want to make sure you get your thumbs. It's kind of a circular motion around your thumbs, other thumb. And then the palms of your hands, you do the fingertips around the palm in a circular motion. Get your fingertips nice and clean. And the other hand. And then my wrists. And that was 7 different steps. And if you do those 7 different steps for about 3 seconds each, you're going to get your 20 seconds of wash. And then I rinse it off and use my paper towel. Just the basic things of keeping yourself healthy, and those are the ways that you can help reduce your risk of getting sick and risk of passing on illnesses to others.
Curtis Booker, ABC4.com.
Welcome back. Every Monday, we've been asking experts your questions about the coronavirus. One viewer wanted to know this: do I need to clean the items bought from the grocery store? Here's Nick Rupp with the Salt Lake County Health Department.
The answer is probably not. It is probably not necessary to clean food packaging after you bring them home from the grocery store. First, the CDC reports that while the virus may survive on some surfaces, such as metal and plastic, for up to 72 hours, there are no documented cases of transmission from food packaging or even from surfaces. The FDA also reports that there's no risk from food packaging identified to date. The most important thing you can do after being at the grocery store is wash your hands as soon as you get home and before you unpack your groceries.
All right, one way to lower your number of trips to the grocery store is going directly to the source. We're talking Utah's farmers. Many of them have been hard hit by this pandemic. ABC4's Jordan Verdadero asked one northern Utah grower what you can do to help them and how they can help you.
I spoke to some farmers who are encouraging residents to go to farms for produce instead of supermarkets during this pandemic, because not only is it fresher, but it's safer.
Do you know the difference between a good peach and a bad peach?
Randy Lemon, owner of Grammy's Fruit and Produce in Willard on US 89, showed me as we stood 6 feet apart.
Some open, some closed. The open ones have probably taken a hit.
Lemon says the frost last night has damaged many farmers' fruits, but he's still hopeful this season will bring great produce.
But there's a lot of still tightly closed buds, which have been protected from the frost, which should still give us a good full crop.
Lemon says by going directly to Farmers for Produce instead of grocery stores, you can practice social distancing safely.
More of an open air market. I feel very comfortable that customers will feel and should be safer in that environment instead of grouped up and closely tied together.
US 89 produce stands open around June.
We will go ahead and follow the guidelines that the state and CDC has out there for our social distancing.
He says another way he and others in this industry make money are through farmers markets. He says by supporting farmers markets this summer, if they're open, you can help the industry tremendously.
We are local. We are small businesses. We need your support. I feel more comfortable in my fruit stand than I do in a grocery store.
Reporting from Willard, I'm Jordan Verdadero for ABC4 News.
Another group of people that could use our support right now, healthcare workers. We learned about a group of RV owners who are lending out their unused campers to healthcare workers who need to isolate themselves from their families. Patrick Warburton of Sandy is one of the volunteers who loaned his camper to an ICU nurse who works at a Salt Lake City area hospital, and he did it free of charge. He says they were connected through a Facebook group called RVs for MDs.
After I was able to think about it for a little bit, I realized that somebody could use this way more than myself at this point, especially with us being on lockdown, that we could lend that out and help someone else.
Yeah, way to go. The nurse who is living in Warburton's RV parked it in her driveway. She says thanks to his generosity, she is able to see her family while still social distancing to keep all of them safe. That does it for us tonight on this special edition of ABC4 News. We will see you back here at 10.